So it's to provide you with information on your contracts. It's to provide you with information on the new schemes that have come out this year. It's also to demonstrate the templates and searches that you need to use and how you can maximise your uptake. And then also we're going to highlight what CEG can offer you. So moving on to your local incentive schemes, you've got your AF, your diabetes and injectable therapies, your respiratory, asthma and COPD, and they're the LISs that you've been doing for roughly the last 5 years. And then you've got your 2 new LISs, which is the SMI cancer breast screening and the T Today programme. With all of the LISs, the template that you should be using is the long-term conditions, and that covers anything from CVD to diabetes, all of your local incentive schemes, and it also covers everything that needs to be done for QOF as well. The templates you should be using, you EMIS, you are currently on version 3, so the LTC and LIS, and in System 1, you're currently on version 2. This is the LIS information page within your EMIS template, and if anyone forgets what they need to do for payment, whether it be doctors, nurses, social prescribers, they can click on this part within the template and it will tell them exactly what needs to be done for each LIS to receive payment. And then this is what it looks like in your System 1. I'm going to start with your AF case finding. Your AF case finding is looking at patients that are aged 65 and older who are not on the CVD register and do not currently have AF. They must have a pulse rate and a pulse rhythm recorded. The work that you need to do to receive the £85 per patient that's diagnosed, they must have an irregular pulse. So first of all, pulse rhythm recorded, pulse rate recorded, and then of that, it's an irregular pulse. Once they've had the irregular pulse recorded, they must have suspected arrhythmia recorded as well. From that, you would then move on and do a 12-lead ECG. Now, if you don't do 12-lead ECGs within your practice, there will be a practice within your PCN that can take this up for you. If you are unsure of who that is, please contact your PCN manager and they will be able to tell you who can provide that for you. And then depending what comes back from the 12-lead ECG, if it confirms that they do have AF, then you need to code AF as a problem. So to receive the £85, every one of those things must be recorded. So if you use the the case finding BHR template for that, that has all of the asterisks in there so that you will get the maximised payment on there. Then we'll move on to the risk stratification part. And we know over the years, this is what practices have found quite difficult because a lot of it has to be recorded on the same day, etc. So with this, you're looking at your newly diagnosed patients from the 1st of April 24, and they must have all of the below recorded. So they must have a CHAD-FAS score recorded. And as you'll see, that says record on this. Can you please mute your mic? Thank you. So you have to have a CHAD-FAS score recorded, and it does say record on the same day. And what we mean by same day is, say, for instance, the patient was diagnosed on the 1st of July. It would be the next time they came in to see the doctor. So the appointment should be arranged specifically for this, and that's what it means. Sorry, can you please make sure your mic is muted? Thank you. Sorry, so yes, with the on the same day, it's the time the patient is seen by the doctor after diagnosis. So they want CHAD-FAS score recorded. They must have a discussion and be provided with the patient information leaflet, also on the same day. The AF care pathway must be followed. there's the link within the template, and then the tick box for AF care pathway must be ticked, and that's also on that same day. Care plan agreed. So again, care plan, to go over the care plan with the patient and make sure that the box is ticked within the template on that same day. BP and BMI can be done on that same day, or it will be accepted if it's done within the 3 months previous to them being seen. The smoking and alcohol, as long as that's recorded within the financial year, that's absolutely fine. So that does not have to be done on the same day. And then lastly, the patient would need to make another appointment once they've had their blood tests done. That's worth £42.50 per patient if you complete all of those steps for each patient. Then moving on to the anticoagulation, again, this is another bit over the years that I think not practice have struggled with, but I think it's just a bit of miscommunication as to whether the practice is meant to be initiating anticoagulation or not, and you are. If the patient has an orbit score of above 4, they are required to be referred to a specialist and not to be given within the practice. So what you would do is the doctor will speak to them, they will have a discussion about starting anticoagulation, and if they start them on the anticoagulation, just make sure the box is ticked. And say, for instance, they're going to start them on a Pixaban, make sure that the medication is issued. It cannot be put on to the medication module and then not issued, because that will not count. It has to be an issue of the medication. And then where the patient is prescribed a DOAC, the GP will commence and refer for counselling to the community pharmacist or ongoing management as well. And that is also worth an additional £28.33 on top of the £42.50 from the risk stratification. And then after they've had the initiation of anticoagulation started, they need to have a follow-up 4 to 6 weeks after they've started the medication. And with this, they also need to factor in, depending what medication they're issued, it's required that you do another blood test at least 4 weeks after. So what we advise is from when they have been given, so started on the anticoagulation, give them an appointment already. Depending if they need a blood test, you might be best in around 5 to 6 weeks time. But if they don't require another blood test, then maybe give them an appointment after that 4th week, just so you're planning ahead and so that you can get the money for this part of the LIS, because you are eligible to get 3 different payments for this LIS if you meet all the requirements on them. So for the follow-up appointment, you go to the follow-up section within the template and then make sure that the anticoagulation follow-up box is ticked. And like I said, that's an additional £28.33. And overall, if you do all 3 payments, it's £99 and a few pence per patient if you complete all 3 sections. And then this is where your support searches are for the case finding. Your top screenshot is for EMIS and the bottom one is for System 1. And then this was just to show you that you do also have a dashboard available to you. It's available on the website. If you don't already have the login details, then please do contact your facilitator and we can give you the login details. This does go up monthly, roughly around about, I would say, the 14th of each month is when the next month will be available. So please do let us know if you need the login details for that. Does anyone have any questions so far about the AF? If you could let us know if anyone's got their hands raised.
Yeah, there's Amber Shah from Good Maze Medical who's got his hand raised.
Okay, yeah. Dr. Shah, if you want to unmute your mic.
Yeah, thank you. I just wanted to ask you, we were given these CardioCore devices to check the pulse rate and record ECG when AF project was launched about 3 years ago, and it all kind of stopped during COVID times. Are those devices still active, or can they be reactivated?
I believe you can use them to do the pulse check, but I would have to get confirmation whether you can still use them for the 12-lead ECG part.
It has to be a 12-lead.
It has to be 12-lead ECG.
Yeah, no, I think they recorded single lead ECG, and you could put that into the patient's medical record and then refer them patients to for 12-lead ECG. So I just wanted to know, because I have still got that device in my practice, but I'm not sure whether this is still operational and functional or not, and who can actually confirm that one way or the other.
Okay, we will take that back and get confirmation for you.
Okay,
and let
thank
you
you.
know.
Thank you.
Smithish?
No more hands up or questions.
Okay, so we will move on to your diabetes, and we'll start with your 8 care processes. It's just making sure that each financial year you have all 8 care processes recorded. They need to have their blood pressure, BMI, HbA1c, cholesterol, serum creatinine, urine ACR, foot exam, and smoking status recorded. You are required to also record any information you get come through regarding retinal screening, although it is not part of your payment, but they do want to know this information just for quality purposes. So please do make sure you are recording that as well. And this is just a quick slide. I won't go into too much detail, but this is the payments. Hopefully you're all very aware of these. You've got your standard target, which is if you are below 50% on your 8 care processes, unfortunately you get no payment at all. And then the maximum is the 60. The higher performers are from 61 to 75. But your target that's been set by ICB is 65% is where they would like you to hit. And then you also have a PCN target as well. And that is, as a PCN, you're required to get 60% to get the extra 8p per weighted patient. And then moving on to your 3 target treatments, we've got your BP and HbA1c, and this is looking at patients that are aged 17 plus, on the diabetic register and without moderate or severe frailty. And you've got 2 different cohorts for your BPs, although it is a combined target. You've got your patients on the diabetic register with hypertension. You are looking to have their BP controlled at equal to or below 140/90. And your diabetic patients with CKD and hypertension, you are looking to have their BP controlled at 130/80. Your HbA1cs, they need to be controlled at equal to or below 58. And then moving on to your statins, so the CVD management. This is aged 18 years and older without CVD, including your newly diagnosed diabetics and without moderate and severe frailty. So it will be calculating their Q risk, and if their Q risk is equal to or above 10%, that you offer statins. So please do make sure that you are using the template to record that you've offered them the statins. And so that's your low intensity statin, sorry. And then the aged 18 and older with CVD and newly diagnosed diabetes and without moderate and severe frailty is prescribing them a high intensity statin. Then we've got your payment section. So here, your HbA1c and the CVD statins, if you reach below 51, unfortunately, there's no payment. And then you've got the maximum of 80 and above. And then the BP is under 61. Unfortunately, you don't get no payment. And then the maximum again for that is 80 plus as well. And here are your searches. So your top one is EMIS and the bottom one is System 1. That's where you can find those. And again, we've got your dashboard here. So this is, you've got your care processes and target treatments, and the new T Today program is on this dashboard. Again, if you don't have login details, then do please let us know. Moving on to the injectable therapies. So the first one is the insulin initiation. It's diabetic patients aged 17 plus with a HbA1c of equal to or above 64, and that they are on 2 or more oral therapies, but you must give priority to those that are on 3 or more. And this section, you can receive £250 per patient that you initiate insulin on. So as you can see, we've just given you a brief information on what this should include. So initial consultation, initiation of therapy, the follow-ups, that you do a 2-month check on them as well to repeat their HbA1c, and then the ongoing management as well. So make sure you follow up the patient and assess their HbA1c at least every 6 months, and then after that it can move on to yearly. So that's your insulin. Moving on to your GLP. So it's the same as above, apart from the follow-up section is slightly different. And that is, you have to provide 2 follow-ups, normally at the first week and then the second week. And then making dose adjustments according to once they've had their HbA1c and blood glucose done. And this is worth £94 per GLP initiation. Does anyone have any questions?
I've got Dr. Vinod.
Do you want to unmute your mic?
Yes, I wanted to know why the GLP-1 patients need a follow-up at 1 week and 2 weeks. Is there any reason? Or?
I'll be completely honest, I'm not sure. I can find out for you. That's what was on the spec, so I'm not too sure. So I can definitely find out for you.
Okay, thank you.
There's a Dr. Shah.
Unmute your mic.
Yeah, thank you. For the practices that do not do in-house insulin initiation, is referral for insulin initiation, will that qualify for payment?
No, it has to be in-house.
Okay.
There's no referral for part of the LIS, unfortunately.
Okay, thank you.
No. Someone's asked in the chat, are there any searches for the LIS?
For the insulin and GLP, is that?
They haven't specified, they've just put, are there searches for the LIS? Yes, she's put yes.
Yes, okay. There is not support searches, unfortunately, but we do provide a dashboard. The dashboard is quarterly, it's not monthly, so you can get that on our website as well. So you'll find the first one will be available hopefully within probably about the next week for the first quarter.
And there isn't any more questions.
We'll move on to your respiratory care. The first part is your case finding, and this is trying to find so the patients to diagnose to see whether they've got a respiratory asthma or COPD. It's worth, if you do a COPD spirometry test, it's worth £110 per spirometry that's done, and for asthma it's £23 per pheno. It's making sure again that you've got the case finding template that you can use for this, and making sure everything is coded correctly. We have got searches for this, so we have identified the patients for you. You then open the template. You must make sure that they have suspected asthma, because the searches work where it puts them both in the same category. You then have to look at them and separate them out. Is it suspected asthma they have, or is it suspected COPD? So once you've done that, you would then move down. So if it's a COPD patient, you would then send them for spirometry. If it's an asthma patient, you would go through the steps and do the pheno to see whether they are asthmatic. With this, we do know, I think last year there was the issue of not a lot of practices do spirometry anymore within practice, so it was referring them out. So please do speak to your PCN managers to see if they are still helping with this, to help you with doing the spirometry tests. And then also, if they are newly diagnosed with COPD or asthma, that you offer them smoking cessation. That is not part of the payment, but it is being looked at for quality purposes. And then we've got your normal asthma and COPD reviews. So this is just a little bit extra money that you can get on top of doing the work that you do for QOF. So your asthma patients, again, using the LTC template, make sure that you tick the asthma annual review box within the template. They must have their ACT score done, and then they must have their management plan either done or declined. So if they do decline, please make sure that you record that as well. And that's worth £6 per annual review and care plan. But again, it's just that little bit extra money for you on top of what you're already doing for QOF. You do also still have the quality factors that have been there for the last 3 years. So just making sure that they have smoking recorded, etc. Those things that have always been there. So please do make sure that you are still recording those as well. And then your COPD patients. So this is worth £10 per COPD review and care plan that you do. So again, LTC template, make sure you tick the COPD annual review box, that they have their CAT score done, and that they have their management plan done. Because with this, as you're very well aware, the COPD patients, they cannot decline to have the management plan done. They must have a management plan done. And then we've got your searches. Your top ones are EMIS and your bottom ones are System 1. So that is your case finding and your annual reviews there. And then here is your respiratory dashboard as well, if you've not seen it before.
Does anyone have any questions regarding this section?
There's no hands up or any questions in the chat as of yet.
Right, so I'm going to pass you over to Billy now, and she's going to go through the new Liz's with you.
Hi everyone, so I'm going to look at the new incentive scheme. So first of all, we've got the wider determinants, then we have the SMI breast screening, and then the T Today programme. So let's move on to the wider determinants. So the wider determinants scheme is jointly led by us and NHS North East London. So the aim is to support practices to record high quality data in 2 areas. So firstly, it was your consultation types and job roles, which is this part. It's phase 1, where we'd sent you a fact file, you would amend your consultation types and RBAC roles to the recommended ones on our fact file and send us proof of this, so screenshots that this has been done. The practices will receive 10p per weighted patient. Once you'd sent that and we'd agreed that they were all okay. So roughly, obviously, if you're at 3,350, you would receive roughly 350 pounds. And invoices have already been sent out to quite a lot of practices in BHR. So if you're not sure if you've done this, please do contact myself or Tracey, and we'll happily look in to see if it's actually been completed yet or not. This is very quick money and it is a very simple task to complete. And then we can move on then to the phase 2 part 1, which was looking at achieve a minimum of 95% on ethnicity, language and communication needs. So we have provided support searches for these, which I will show you shortly. And then you have your phase 2 part 2. So this was to achieve a minimum of 25% for looking at for isolation, literacy, communications in a deprived area. And then you have your phase 3, which will be a visit from us either via Teams or face-to-face. Once you hit the minimum of 25% on part 2, you can request for phase 3 visit and payment before you receive the payment for part 2, which will end in April 25. Now moving on to the SMI breast screening. So this project was aimed to increase uptake of breast screening and reduce health inequality and any barriers that are stopping women from having this breast screening done on the patients that are on the SMI register. So this is going to be across BHR. The Cancer Alliance team will be contacting the PCNs when this does go live, but we just wanted to give you a brief of what it would entail. So firstly, it would be to import our searches and then identify these patients and sense check the register is tidy and it is the same as the Cancer Alliance team. And this would be £14 per practice. Then you would be sending out an endorsement letter, and this will explain that they've been identified for not attending their breast screening and to contact the practice to have the breast screening done. And this would be 10p per patient who is sent the endorsement letter and a patient identifiable patient information leaflet, and it's £10 for that, and that includes the admin fee. And then you'd move on to the patient engagement. So this would be the practice would telephone the patient to book them in. And this would be a should be around a 20-minute appointment with a primary care SMI breast screening consultation appointment to go through any barriers that are currently there. The template to use for this is already available, but like I said, you don't need to start using this or the searches at the moment until your PCN is contacted by the Cancer Alliance team. And this is version 1. And then you do have support searches available as well here in both EMIS and System 1. Does anyone have any questions so far?
Hi, Billy. I think Francine Marks has got a question.
Yep. Hi, Francine.
Do you want to unmute yourself?
Can you hear me okay?
Yeah, I can hear you.
Sorry, I know I'm a bit like a dog with a bone, but our practice still have not received last year's phase 1 accreditation. Has anyone else?
It has been sent, that invoice.
So Francine, you would have received the invoice that I sent to you, so you then had to send it on. Did you send it on to the email?
Yeah, I did. I did do that.
Okay.
Yeah, so you can contact the email address that you sent it to and just advise them that you haven't received the payment as yet. Yeah,
Will do. Thank you.
That's
Thank
okay.
you.
Are there any other questions?
Nothing more on the chat, or no one's got their hand up either.
Okay, so we're going to move on to the Tea Today program. So this was an extended consultation, 30-minute appointment that should be offered to patients with type 2 diabetes aged 18 to 19, and it would 39, and it would be £52 per adult, which would include you clarifying the diabetes type, preconception advice if they fall within that age range, looking at the cardio risk and weight management and referring them on to any weight management programs as you feel necessary, assessment of their well-being and social needs, and also a depression screening. So this is on top of your diabetes annual review. So the template for this, I just wanted to give you just a little bit of a brief of where you can find the template. So it will be on the LTC template on the diabetes page, and it will show right at the top. So we are using visibility rules. So if the patient is eligible, you will see first the extended consultations on your diabetes page. And then the clinicians are expected to do a mop-up of any 8 care processes that are missing on this extended consultation as well. So as you can see here, this is just to quickly show you, it will show at the top extended consultations. You must tick the diabetes extended appointment follow-up and then move your way down to look at their HbA1cs, like I say, weight advice, and then down to the assessment, which is looking at if they understand the information they are given by healthcare professionals, if they're having any problems with housing, money problems, or how they're feeling, if they're feeling lonely. So this is all part of that. Plus, as I mentioned previously, the 8 care processes, if they're missing any when you do this extended consultation, then you should do the mop-up of these as well. So here you can see that there are support searches available for you. So the top is EMIS, the bottom is System 1. As you can see here as well, you've got a recall, which is folder, which is those that are eligible. And then you have your support folder, which will tell you who has received an extended consultation. And then you can look at the quality indicator report as well. Anyone have any questions about that? Because I am going to do a live demo as well.
There's no questions in the chat and no one's got their hand up either.
Okay, let me just get my EMIS open.
Just having EMIS issues, hopefully. There we go. Be with you in a second.
So firstly, I'm going to just go over the support searches. Can everyone see my folder?
Yeah, we can see that now.
Okay, so first I'm just going to go over our support searches. So they are available in our practice support searches 24/25, and your Liz contracts can be found in our ICB contracts folder. And in here you have 3 folders. So you have Liz, how am I doing, which will show you all of your Liz's individually, because we have separated them out. When we've discussed this with practices, they felt it was better to spread them out, and System 1 also has the same set out. And then you can go into each individual Liz folder to get the support searches for them. And then, as I previously mentioned, the new scheme, this is your T Today program. So this is available also in your ICB contracts folder, and then your wider determinants of health. So with this wider determinants of health, we have rearranged the way our searches were and made it easier for practices. So now you can see how you are doing in this, so broke up into parts. So your part 1, as I mentioned, these have to be for everyone over the age of 16. They should have ethnicity, language and contact preference, and this should be above 95%. And then you have your part 2, which is your target cohorts, and these are all newly registered from the 1st of October 23, which should have housing vulnerability, income, health literacy, and we did create a Accurex that can be sent to these patients as well. This was available on our e-bulletin, but if you don't have the Accurex, then please do contact us and we can send this over to you for you to download. And then it covers your target cohorts as well, which are patients in deprived neighbourhoods. And as I mentioned, these need to be at 25% before you can trigger for your phase 3 visit. Yeah, and then it was to look at maintaining it because it is up to 95%, and then you will receive the payment in April next year for these ones. And then you've got your missing criteria. And again, it's just broken down for you so you can go in and see who's missing out of these cohorts. And then in the PCN contracts one is where you can find the breast screening. But as I mentioned, you don't need to do anything with these at the moment until your PCN is contacted by the Cancer Alliance team. And this is where you would find them searches as well. Are there any questions about the searches?
Someone's put in the chat, can I please have a copy of the AccuRx message as just discussed for the wider determinants?
Yeah, can you either email myself or Tracey, depending what practice you're in, and we'll happily send that over to you.
There isn't any more hands up and there's no more questions in the chat. Oh, someone has put the hand up. Nadia Said.
Hi. Yeah, can you hear me?
Yeah.
Yep.
Hi, thank you. Really helpful. I just wanted to know if the T2-day program could be done as a group consultation, or does it need to be one-to-one? And the second question is, can a social prescriber address all the concern about the housing, and because a lot of it is not actually clinical? Thank you.
Yeah, so a social prescriber could do the loneliness section, but as it is a clinician that would be doing the actual extended consultation, so it's not a group one, it is per patient. The clinician would be the one asking them questions on the day. But for the wider determinants, that is slightly different. That can be a social prescriber and any clinician that you wish.
But
Thank
can I
you.
just add, with that, practices are not meant to pass the wider determinants work over to a social prescriber. It would just happen that if the social prescriber was seeing them and some of the information was missing, then they would happily do it. But it is not solely down to the social prescriber to get this information.
Because once you get the information, if they do need help or they are having money problems, that's when they would move on to see the social prescriber. Are there
Thank
any
you.
more questions about that?
Yes. Someone
Yeah.
says their Liz searches keep failing. So the how am I doing ones, version 1.
That might be good old EMIS problem, unfortunately.
Is it the wider determinants?
Is it
They
wider
haven't
determinants?
hang on. They've just copied over one of them on EMIS, and the Liz how I am doing has failed. So
sorry, that's me. It's Steffi at Cleveland. No, the T2-day program and the wider determinants is running, but the Liz how am I doing version 1 is just failed. They've all failed. Asthma, AF, diabetes, they've all failed. It just says failed.
Okay. Could you try again before you leave, because sometimes EMIS is playing up and not running searches to overnight. If you're still getting the problem, then please do contact Tracey, and then we'll contact EMIS and see what's going on with that.
Yeah,
for you.
I've copied them over twice and deleted them and copied them over, but it's just that one. Everything else is running, which is
Yeah,
Steffi, someone in the chat has actually suggested for you to run them individually. That might work.
Okay.
Yeah.
Maybe they're too big. Okay, thank you.
We did try it as well. It's showing the searches are failing now.
Billy, there's another question. What template do you use for the type 2-day program, T2-day program, sorry?
The T2-day program, that is the diabetes page on the LTC template. So if the patient is eligible, it will show at the top of the diabetes page. If they're not eligible, then it won't show at the top for you. So it's their normal LTC templates on both EMIS and System 1.
And then we've got, I think, Dr. Shah again with the hand up.
Yes, thank you. Just a comment really. I think this business about clinicians having to see the patients on a one-to-one about wider determinants and not...
No, not wider determinants. That wasn't a question regarding wider determinants. That was about the T2-day extended consultation, the diabetes one. Wider determinants doesn't have to be done by a GP.
So all the work related to wider determinants can be passed to social prescriber.
No, not social prescriber. It can be done. We've created an AccuRx flurry that can be sent out to the patients, asking them these questions, and then it should be part of your new patient health checks for the others. And then the consultation types and job roles can be done by your practice management. So it isn't actually a clinician involved in the wider determinants.
Okay, thank you. Thank you for that clarification.
Okay. Are there any other questions at all?
I can't see any. There's no more questions. No one's got their hands up.
Okay, so I'm just gonna, can everyone see my screen
Oh,
for
Billy.
the template? Yeah.
Someone's just said on the slides, would it be possible for each dashboard to state when the dashboards for specific LISs will be updated, as some are monthly and some are quarterly?
We can put it so most of them are monthly. The only one that isn't is the injectable therapies, but we can put a little note on there before we send it out to say that that one is quarterly. But the others are monthly. But we'll put a note on there, that's fine.
And there's no more questions.
Okay, can everyone see my template resource publisher now?
Bevish, can you see
yes, yes, we can.
Yeah. For our eyes.
Okay, so I'm just going to quickly go over the LTC template. So as Tracey mentioned, there are Liz information page, and then you have your lab results page. You've got your Liz information page. So like she mentioned, it does go through each one. So if the clinicians are unsure, then they can have a look at this page. You have your lab results page. And then for these examples, I'm just going to show you the diabetes and the AF page. So you've got your AF page. So we use visibility rules within this template. So it will only show what's relevant to the patient in front of you. As you can see, this patient is a dummy patient. They've got quite a lot of different problems, but it does cover the whole QOF area, plus all your LISs in this template, but it will only show what's relevant to the patient that is in front of you. So as Tracey mentioned, you have your QOF targets here at the top, and then you've got your CHADVAS score. So you have 1 star next to anything that is QOF. And then as you move down the template, you will see that there are 2 stars for anything that is for your LIS, for your local incentive schemes. And then I'm just going to quickly just give you a little glance. And if they are newly diagnosed, they will have a section that comes up about risk stratification. And then diabetes page, you can see here. So this is your annual review because this patient's not within the age range, but you will see it right at the top, extended consultation, if they are eligible to have this done. And then you have your generic pages here, which is your reasonable adjustments, your carers, adult IMS, cervical smear will only show if the patient's within the age range, your PHQ 9 and GAD7, lifestyle and wider determinants. So wider determinants is on all of our templates as well, new patient health check and the LTC template. And then you also have your ethnicity here as well. And if you're ever unsure what changes have been made, you can look at the version control here, and it will tell you what changes were made and when they was made if there's a new version. Are there any questions about the LTC template?
There isn't anything in the chat and nobody's got their hands up either.
I just mentioned when it comes to the stars or the asterisks on the template, as you've just seen on the AF one, as Billy pointed out, the CHADVAS has 1 star on it, and that's because QOF trumps the LISs. So although it is part of your LIS, you are required to do that. It's only got 1 star because obviously we can't put both on there. So it is 1 star, although it is what is required for your LIS as well.
There's a question from Bhumika.
Hi.
Hello. If I'm not wrong, I'm just searching for the template on our system, and as you open it here, it doesn't show dementia. Like few of them, dementia, few other templates in the list. Template.
So for the dementia, sorry. Hello?
Yes, it is the dementia, and if you could open the template again. There were few of them which were not there in the template that we have.
Yeah, because there are visibility rules within inside, so it won't. This is not showing you every page that's on the LTC template. It's only showing you what's been coded in this dummy patient.
Okay.
It depends what patient you're opening. So obviously they have to have these registered as problems for the pages to show. Yeah. So it won't show everything. So obviously this patient's showing because I've coded dementia. So that's why it's showing for this dummy patient. But only if the patient's got dementia will this page show for you.
All right. Okay. I opened the dummy patient, so I think
yeah. So you'd have to code them as
thank
that,
you.
and then I just wanted to go over, just quickly show you our women's health template. So this template is available to all the practices. It's a very good template. As you can see, I've put in pregnancy and stuff into this patient's dummy records. So it does cover adult IMS. It covers all the prenatal, antenatal appointments, where you can go in and check and make sure everything is up to date. If they are within the age range of cervical smear, again, it covers that. If they are in the age range of mammograms, it will have a mammogram page show. Then it covers all your contraception implants, emergency contraception. There is a fertility page, IUCD section as well. So this is really, like the LTC, a one-stop shop for anything that is to do with women's health. And again, like I mentioned, it's got the postnatal here as well, and sexual health in this template. So if you're not aware of this template, please do start using it. It's a brilliant template. It's Women's Health version 1. And then I just wanted to quickly just show you the F12 key that we currently have for all your templates. So it's called CEG Template Launcher BHR version 3.1. That version will change, but you don't need to do anything about it. If you're not sure how to add this, you can just right click on the letter add and then search for that name. And then once you've got it here, it's a quick, easy way to access all our templates that are available to you. So it will give you a list and you can just access the templates via this protocol. And we always update them in the background, so you don't need to worry about new versions, because I would have already updated it for you, and the protocol will update itself as well. So once you put it on, you literally will always be using the most up-to-date version of the templates, and it will give you a full list of what we currently offer the clinicians. This does have to be done on each PC. So I would advise any clinicians that are interested in having this, then please make sure that they put it on their own PC, or you go around and check and help anyone out if they need to have this done for them. I'm happy for anyone to email myself or Tracy. We're happy here, and we're here to help regarding this if anyone's unsure what to do.
But
yeah.
They just want you to repeat the name of the protocol again.
Okay. So it's CEG Templates Launcher, BHR, and at the moment it's version 3.1. So when you do add here, you can just add that, and then you can search up here, CEG Template Launcher. Nope,
And you just won't find it for you.
Yeah. If you're unable to find it this way, you can go into your shared folders, and it will be available in our BHR protocols, and it's here available for you. Yeah. So if you're unable to find it by searching, just come to here and you can add it that way, and then it will automatically add to your protocol.
You do forget we do have instructions that we can send to you as well, so just pop us an email.
Thanks. There isn't any more questions or any hands up.
I'm just going to stop sharing this and go back to my live demo. Okay, so we've done this, and now we're going to just move on to what CEG can offer you. So we do currently offer face-to-face or MS Teams practice support visits, which we will be coming out and starting visiting the practices in July. So keep an eye out for our invite emails. We also provide you with practice support searches. If you're ever unclear or don't understand the searches, or you need us to just show you how to use them, please do contact us. We're here to help in any way. And we offer you our CEG templates, our dashboard. So if you, like Tracey mentioned, if you don't have a login detail or you're not sure, then please contact us and we can provide you with this login details. We provide our APL tools, which is your IMS, recall tool, renal tool, cancer audit tool. We have quite a lot of APL tools that are available. We provide our drop-in sessions. These are monthly. If you have not received an invite for these and you would like to attend, please drop myself or Tracey an email, depending on which locality you're with. In these sessions, we go over any updates from our e-bulletins. We have been doing some demos of the APL tools. And then we asked you if there's anything that you're unsure about and we can cover in these sessions. So they are drop-in sessions. You don't have to stay the whole half an hour. You can just pop in and ask us a question, or you can stay for the session and we go through different agendas. And then we also offer our webinars. And here is just our names and email addresses for your local facilitators. Are there any questions at all?
No one's got their hands up and there isn't any more questions in the chat.
Wait a minute or so, just in case someone's typing. Or... No. Hopefully we've been very clear and covered everything that you've wanted us to cover. If there is anything that we've missed, then please do let us know. Just give us an email and then we can go into a bit more detail if that's what you require, or if there was something that we didn't touch on.
And we will be sending out the slides to you, to all of you. Mevish will be sending these out to you, and also a feedback form. If you could complete that, we would really appreciate that. But yes, we hope to see you soon, either in our drop-in sessions or in our next webinar. Thank you all for attending.